It's a collaborative approach. It's community driven to improve law enforcement and emergency services to respond to people experience a crisis, especially mental health. These programs bring police together, mental health professionals, advocates, and lived experience to develop training protocols and partnership to ensure everybody has a voice at the table and to work along each other instead of apart.
We're just very excited we've done work through the years in Pennsylvania, and this is taking it to a whole new level. So we're not seeing many states right now that are really promoting or funding it from a state level. There's a lot of CIT work around the country, and it's a lot of phenomenal work going on around the country. But the leadership out of Pennsylvania, sort of with this type of vision, I think is at the forefront.
Here at the Council of State Governments Justice Center, we are very excited to be selected to be a part of Pennsylvania statewide CIT TAC Center. For some time, Pennsylvania has been very progressive with their CIT training and their crisis system response. And to be honest with you, it's almost mind-boggling to think that this will be the first CIT TAC Center in the nation. And I think many other states will see the value of this approach and follow suit.
The leadership within the Pennsylvania Commission on Crime and Delinquency have had a really strong interest and support of CIT programs. The new Pennsylvania CIT Technical and Training Assistance Center, I think, is going to be a really good opportunity that does support CIT International's mission. Through providing technical assistance, it's helping communities stay in line with best practices, which is what CIT International holds out there as the gold standard.
The Mental Health and Justice Advisory Committee, or we like to call it MAGIC, the best acronym in state government. It is a little bit of magic. Is part of the Pennsylvania Commission on Crime and Delinquency. And our mission is really to strengthen how Pennsylvania responds to people with behavioral health needs who come into contact with the justice system.
They've been proactive in creating a vision for Pennsylvania to see that every community, every county in Pennsylvania has a CIT program. It's the leadership that's, to me, what has made Pennsylvania stand out nationally in this endeavor. And I'm going to give a shout out to Jackie Wheatneck, because Jackie has been central to this for the state of Pennsylvania.
So we bring in leaders from across the systems, courts, corrections, law enforcement, behavioral health, people with lived experience to advance policies and programs that promote safety, treatment, and recovery rather than punishment.
They've provided funding to communities to start their CIT or advance their CIT, and they've been sponsoring an annual conference to bring communities around Pennsylvania together to enhance the collaboration. The Technical Assistance Center will really help communities develop strong programs that have strong training, and then also have the ability to collect good data that shows positive outcomes for people in crisis, people that live with mental illness, but also help communities improve their system.
And this really has truly been a collaborative effort with PCCD, OMSAS, the AOPC, the Administrative Office of Pennsylvania Courts, county leaders, peers, and people with lived experience. And we're all really just working together to design a system that meets people right where they are and prevents them from even entering the criminal legal system.
I think this center is, just fits right in line with CIT International's mission, and we're just looking forward to working hand in hand and collaboratively.
Being a police officer for 30 years, I have seen CIT help strengthen legitimacy between community and law enforcement. When law enforcement leaders support CIT, this truly redefines what safety is. It no longer makes it the absence of crime, but truly is the presence of well-being. And, when communities feel heard, then this leads to validation.
So my mother suffers from bipolar disorder and schizophrenia. So when I became a police officer and saw other people struggle with the same kind of disorders, or sometimes worse, I had more empathy than most.
I found out CIT provided that method that could build upon kind of like what was my already more empathetic approach. I was kind of the officer that wore his heart on his sleeve already. So I was able to kind of build upon that and use the methodology, the skills and knowledge that I learned in CIT to just be more effective and help people de-escalate better and help them get the resources that they need that can actually help them, further down the road and not just that moment.
I wanted to find that person more help instead of putting them in jail. I treat everybody with dignity and respect that I would give my mother.
And CIT teaches officers truly to focus on the person and not the problem. It stresses true connection over correction, right? And when this happens, we've seen positive outcomes for both the community and law enforcement.
Sharing of knowledge and best practices between programs throughout the state, that is absolutely phenomenal. I think it will improve all the CIT programs in the state, which is going to improve officers' response. It's going to improve the services we're able to provide. So it's absolutely phenomenal.
The TA Center will solve a problem that so many other agencies run into when they first begin a CIT program. It will create a shared language. There's many agencies out there, and they realize that there's some amazing support for those in the community, but all those agencies continue to be siloed. And when you share information and you have collaborative approaches, this is what makes a CIT program successful. And the TA TAC Center coming to Pennsylvania will be a gold standard for other states to look at.
CIT is important because it reduces injuries, minimizes unnecessary arrest or hospitalization, and improves outcomes for people in crisis. It really emphasizes de-escalation, empathy, and timely access to appropriate services, while also supporting first responders with the tools and knowledge they need to help.
This has solutions that we can look at, and it is creative and it's visionary and it's progressive.
We're really trying to change the story for people in crisis to make the system more humane, more responsive, and ultimately more effective for everyone involved.
Take a look at what Pennsylvania is doing. Keep a close eye on that. And for those in Pennsylvania, now is the perfect opportunity to create an approach to the community that will build and strengthen relationships and trust. This statewide approach sends a message to the community that, we care and that we're invested with you. I can't think of a better program that a state could truly invest in that pays dividends back into the community like CIT does. I've seen it firsthand. It's a program that improves people's quality of lives, and to be honest with you, it saves lives.